Well, as promised, we're hungover. It's the March 18th, post St. Patty's Day. Where did the pot of gold at the end of the rainbow end up? Episode of Health in 2.00.
I know, Jess, I'm looking more like, red-nosed and red-faced and red t-shirted than green.
The party's still going for you. And guess who just got to the party? Did you see the big news? Oh, I can't wait to talk about this one.
Well, there is still yesterday's news, and there's more today's news.
Oh my God, I know. So much news.
It just never
stops. Pot of gold at the end of the rainbow. Here we are.
It is. This week has been, I think, as we weren't a few months back, we thought there's a bit of a lull. Oh Christ! I mean, it's still, the stock market's going crazy. Volkswagen is doing Tesla up 35% today because it's going to do batteries and
all right,
the stimulus package and everything, and the change in digital health. It's all running over.
Oh, it's all coming together here.
It's all coming together here. Okay, you ready?
Oh, I'm ready.
Okay, can I hit that? Oh God, I lost that. We are go.
Okay, we are go. And you know what else is go? Glen Tullman is back, people. He becomes the CEO of Transcarent, adding to the title he already has there, executive chairman. Why? Matthew Holt, what did we learn?
Well, you'll have to watch the interview that you and I did with him, which will be on this very same platform channel soon. But so Transcarent is a new company which is doing navigation and telehealth and centers of excellence, and gonna go direct to employers, give consumers a whole new wonderful experience, do it better than anybody else is out there. And he told us on this channel that there is huge demand from employers, and that's why they set this up. It's the same gang again, Hemant Taneja at General Catalyst, $44 million in funding, which actually was last year. They bought a company called Bridge Health, which is Center of Excellence. You might think this market is crowded because Grand Rounds and Doctor and Devon are kind of doing the same thing yesterday, and accolades in there, but Glenn says no, there's a lot of room for more, and he thinks it's going to be better. So we will see. He does have a bit of a good track record.
He does. We'll see what happens. Excited to have him back. Other news, Happify gets $75 million, bringing their total up to $123 million. You have an interview with the CEO there. What did you find out?
I did. I interviewed the president yesterday on this channel as well. The point there is it's a mental health company like many others, except for it's all automated, all self-service, and they have a self-service coaches and everything else. And if you need, they think 80% of all mental health can be done that kind of self-service way. So that $75 million to add to their pot. They're making a big play. A lot of health plans using them, and some global employers.
All right, 2 remote patient monitoring companies get funding. 100 Plus gets $25 million in an A. Health Recovery Solutions gets $70 million in a C, bringing their total up to 87. How are these different? Why all this money in RPM right now?
Okay, well, RPM is in a growing fast because just cut it in under the wire there. RPM is growing fast because there are Medicare codes to we need to do a better job of monitoring people in their homes. We know under COVID, and the hospital at home stuff is a big deal. A lot of people are moving that area in home care. B, specific Medicare codes which will pay primary care docs to manage patients at home. So 100 Plus, which is Ryan Howard of Practice Fusion fame. I've always had an interesting testy relationship with Ryan, is moved into that zone. He got 25 million, specifically not from venture capitalists, because he hates them after what happened at Practice Fusion, which is the he got it from a bunch of celebrities. Dr. Oz is in there, plus
The Weeknd.
The Weeknd's not in there. He's got a pop star, but he's got some celebrity doctors. He does have Kohlberg and Kravitz of KKR, but individuals not as the fund in there. They're aiming via with their relationships with Athena Health and Dr. Care and others at primary care docs. Health Recovery Solutions, HRS, is aiming at the big systems, like big hospital systems. They raised $70 million. Very smart guy there, Jarrett Bauer, who's the CEO there. Young CEO, has built that almost out of nothing over the last 4 or 5 years. And they've got like 200 plus hospital systems who are using them to do their remote monitoring. Look, this area is going to grow and grow. That will get subsumed into bigger things like the sort of Teladoc Livongo behemoths. but no question that remote monitoring is going to be in hospital at home, and managing chronic patients at home is going to continue to be a huge deal. Whether the Medicare payments stay as quite generous as they are is another matter. 100 Plus has got, if you haven't looked, it's got a very interesting sort of, they made public on Business Insider their pitch, and some of the numbers in there are, if I'm a policy person looking to cut some costs, I'd look at that at some point, but for now it's go, go, go.
That was incredibly informative.
That's the second time in about a week and a half you've complimented me on something I've said on this show.
You're getting better
I'm
and
worried
better.
about you. I'm worried.
You're getting better and better at these. 192 episodes in, and I think you finally got it.
Well, I'm glad a little bit of practice makes semi better.
I'm impressed that we got these scoopy little on-camera interviews with these CEOs that we mentioned today.
Yeah, well, you know, it's kind of interesting, right? Because I mean, we were teasing Glenn about this, but he's kind of putting the band back together, right? So our
We're waiting for Lee. Lee, where are you?
Well, you know, he's got our favorite communications person, John Hallett, who was Jonathan Bush's communications guy, and then became Glen Tullman's, even though those two are not the best.
They're the same person. What are you talking about?
They're not they're not the same person, and they're not the best of friends. I mean, that goes way back to my days of trying to get them.
They have great taste in comms, guys.
Yeah, but he ran away to hang out with Scott Shreve for a bit, and he lured him back. He's got Lee Shapiro giving, it's their money, so it's like weird. I bet you Lee gets dragged back into that. Jenny Schneider seems to have run away for now, and Zane Burke is probably sitting on a beach drinking a margarita or a pina colada somewhere. But
out of all of them, I wish I were Zane. I honestly,
Zane showed up for like a year and a half. I think he had 1% of Livongo.
One of the best dressed.
Put a very large number in his pocket.
Shows up looking fabulous, builds the thing up. I mean, I want to be Zane. And then where is he in this? Like I'd be over there too, like not answering Tullman's calls.
When you look at sort of good jobs to take, and your timing being good, his couple of years there was a very good couple of years for him. But yeah, I mean, it's interesting the way that I mean, you can't stop. I don't know how much money Tullman's worth, but it's a hell of a lot. And he's decided there's another slot to go in, and she thinks there's another. I don't know if there is or there isn't room to wedge in another company in that kind of navigation. What do you call it? Everything in the health plan apart from the claims processing.
It's like everything that you would want in like a next gen health plan, except for the processing of claims. And Glenn actually kind of said it that way too. Yeah. So I think that's really interesting. And then I don't know, even though of course I had to ask for those long time sufferers of my interviews about going public via the SPAC this time, because I can add on to that question.
Because they already have the SPAC, right?
They already have the SPAC in place, and that whole idea of health assurance and what that means, as opposed to, it's really interesting. I don't know. I feel like
he was pretty clear. You have to watch the interview, but he was pretty clear that SPAC is not going to be the purchaser.
Yes, I know, but you know what? He said he's not going public before either. So I have a year and a half of footage on that.
You're now disbelieving.
The winds of time change, fortunes come and go. It's a financing event. Like, I know all of his lines. The best thing about going public is the day you go public. Like, I know them all. I should cut him.
I think the greatest line was, "I like it when the stock goes up." Right after all the bit.
That was after it went public and he finally admitted it.
Yeah, and
I have to check that interview out.
And by the way, the interview I had with Ola Leidner at Happify was pretty interesting. The amount of money pouring into mental health, and the divide between automated do-it-yourself mental health versus using therapists, and Russ Glass from Meru and Christian, blanking on Christian's last name, which is a bit dumb. I know very well from Meru. Sorry, Russ Glass from Ginger.
Yeah, I'm like, why is?
Okay, let me start again.
Oh my God.
The CEOs of Ginger, Meru, Lyra, and others have been going back and
whatever
forth.
their names might be, or
whatever
all
their names might be.
The halt at this point. Can I please end this episode?
All I'm saying is they've been going back and forth about how much machine and how much human, and that's a very interesting mix, especially in mental health, and that debate's going to run around. So, yes, you should really.
The CEO of Modern Health, Allison, who says that she should own the whole thing, and that the patient intake process decides how much tech and how much human. I like that. All right. And on that note, I'm ending this because this is like a disaster now. All right. So check out our interview with Tullman over there on the healthcareblog.com. It is also up on WTF Health YouTube. So maybe venture over there. What else I got?
You're wearing the t-shirt. That one, yes.
Wearing the t-shirt. Go check out WTF Health on YouTube. And be sure also to follow along with us on Twitter, because that's where a lot of our engagement with some of these CEOs begins and also ends, as we learned from Owen Tripp and Neil Ferguson yesterday with Matthew. No, I'm joking. But you should follow the big guy.
They're using the block button well.
Yes, they have. It's like you can't even reply to Hill anymore. But you should follow him over at Bolt Boy, and I am at Jess Tomasa. And then make sure you do check out Matthew's interview with the CEO of Happify Health. That's a good one. All right, guys, we'll see you soon. So much news. Stick with us. We'll talk to you later. Bye.